Hi.
Thank you. I'm also welcoming Dr. Calendar. Hi, Dr. Calendar. I'm welcoming Angela Dixon Watson.
Hello, I'm here.
Still picture only, so
Yes.
hi, Angie.
Excuse me, I'm Maxine. We actually cannot see you, or I cannot see you.
Really?
Yeah.
Now, why would that be? All right, let me go to view. It's on speaker. Does gallery help?
Turn
the video.
Turn your camera on. Hit the
Yeah.
camera, the video.
Oh. Okay, guys.
There you are.
There you are. Well, it's a picture.
That's a picture.
Yeah, but it's not live. And I do this all the time, so how about that? Is that better?
Everybody.
We still see your picture.
Oh, wow.
They see her picture. Their screen.
Best laid plans of mice and men. Please forgive me. My
okay.
apologies.
That's
Okay.
Things happen.
I'm not sure why. Oh, you know what? I may have two screens up, so let me close one. Okay, guys, you'll need to, if you would accept my picture, I'd appreciate it in the interest of time. All right. Can you still see my picture?
Yeah.
Yes. Uh-huh.
All right. Good afternoon, everyone.
Good afternoon.
If I've missed anyone, I can see Dr. Walter V. Murray, Rosemary Wilson Murray's husband. Hello, Dr. Murray. How are you? Welcome. I can also see Lynette Wood. And of course, our highly esteemed Beverly L. Robinson, Sandra, Tim McDonald, Angela Dixon Watson again, welcome. And everybody, welcome. Today, we are going to be talking about vicarious trauma. And after we speak about that, we're going to find meaningful ways of packing up the baggage to move into the palace. The first person that we will have to give us a talk on how to address and resolve vicarious trauma is Dolores Taylor, our esteemed chaplain. Welcome. Please feel free, Dolores.
Thank you. Thank you. I would like to be able to share my screen.
Sure, you're able to do so.
Okay. That's not it.
You know what? That is my screen, so I apologize. Hold on one second.
It's okay. We'll get through this.
No problem.
You have access to it. Uh-huh.
Okay, here we go. Okay, what I wanted to share with you is basically what I have learned through much grief in my life. Some of it has been through expensive therapy. Some of it has been through trial and error. But to move through the grief, I have had to learn how to be present to the presence of God and how to be present in the moment in the cycles of life. And that's what I want to talk about. Because even though the topic is domestic violence, it is still a loss and it pushes us into grief. Grief is like an octopus with suction cups. And so the least little thing can trigger and it can suck us into it all over again, all into our feelings. So I want to cover the life cycles, managing your grief, and balancing your journey. Okay. life has many cycles, and grief and loss is just a part of the cycles. Okay, so is abundance, love, and joy. But many times we focus on the negative part. So looking at some of the cycles, it's the solar, the seasons, the day and night, life and death, breath. And the interesting thing about your breath and these cycles is that you cannot always tell where one begins and one stops. You know, where is the exact point that your breath stops from coming in and then going out? But the key one is relationships, relationships and growth. And I want to share with you a chart that I've created. I know that you cannot see it as, well, you all are a lot younger than I am, so you have good eyes. But I'd be happy to send this on the site. This is called the relationship cycle. And if you put this on like glasses or a template, and you can see all relationships through this, even the relationship that we have with God. I mean, God wanted relationship with human beings. That's why he came. It's all about relationship, but the relationship has a cycle too. And if we understand it, we can better navigate through the landmines. All right, it usually starts out with infatuation or enchantment. Everything is wonderful. If you want to think about your relationship with a significant other, you can do that, or even with your children, or even with God. And then you come to the disillusionment part, where things are not quite right, things are annoying, people not acting like you think that they should. And then we get to the conflict. Now this is,
Ms. Taylor, we don't see your screen if you're supposed to be sharing.
oh, you don't see it?
No, ma'am.
Oh, thank you.
You're welcome.
Let me hit it again. Can you see it now?
Yes, ma'am.
Yes.
Thank you.
Okay.
Thank you.
Let me just go back because I want you to see this octopus. Because all those little suction cups are the things that trigger us. You know, we don't know why we're triggered, but we are. And this was a cycle of life. This was that one. Okay, so this is what I want to get to. So here we are in conflict. Now, when we get to conflict, okay, I'm gonna speak for myself, okay? So sometimes as a woman, when we're dating and we get to conflict with the person that we're dating, we just change partners. Or we do that with the church when it gets difficult. You know, we don't work through it. And that's the thing, grief is work. You gotta work through the cycles. And so we start giving each other the silent treatment, live parallel lives. We think about getting out. There's little or no communication at all, okay? But if you can see the chart with each challenge of the stage, there is also a blessing. And so there's blessings in working through it. Working through the conflict with deeper relationship, you're grounded in security, and the passion comes back. The next stage is resolution, where you work through it, you set boundaries, and you're clear about what you will and will not do, what annoys you, what doesn't. And then from that, you do a re-choosing, where you re-choose the same person, or you re-choose another person, or you re-choose your faith. How many times have we had to re-choose our faith? So, but this is the cycle of relationships that all relationships go through. All right, let me see if I can get this down. Here we go. Now, the grief cycle is a little bit different. And we are all familiar with Elizabeth Kubler-Ross's work. And one of her proteges has been working to do more and to add different stages. You accept the loss, Now, the thing is, you got to feel your feelings. We think that when we are hurting, we don't want to feel your feelings. I know I don't. I call it licking my wounds. My therapist says, "Are they healing?" And I said, "No." He says, "Well, then you need to stop licking and get up and do something." I didn't like it, but it was true, you know? So the grief cycle is not linear. It is circular, up and down, up and down. It's every which way. You can go into one and then the other: denial, anger, bargaining, depression. But at some point, you've got to come to reorganizing your life around the loss. You have to accept it and rebuild it. That is the task. People ask me often, what is the purpose of grief? The purpose of grief is to know God better, to experience some of the things that he experienced, and to find peace and to grow, to give forgiveness. And forgiveness is a gift from God. You have to pray for forgiveness. You can't always forgive a person. Now, when you do forgive them, you may have to set boundaries. Forgiving a person doesn't mean that you go back into the same situation. And then the challenge is to be engaged with life and embracing life. The thing to remember is that you're not alone. You know, many times when we think of our relationship with God, we have a long laundry list of what we want him to do. But the thing that God has promised again and again is that he will be there. Not that he will always fix it, but that he will be there. So it's okay not to be okay. It's okay to seek help. These cycles, all of the cycles of life have movement. You have to have movement to move through your grief. And you have to communicate. Communicate through a journal. These are tools, through people, through meditation. The research has shown that by meditating and sitting in silence, a minimum of 20 minutes a day, that it will heal some of the trauma that is embedded in your psyche. Because we know that 95% of our actions come from our subconscious, and this is the way to heal it. Creativity is also another tool. So I wanted to share that relationship cycle with you so that you know where you are and you know that you can move past it. All right. The other thing is balancing your journey. Your journey needs to be inward and outward. It needs to be being, B-E-I-N-G, because we are human beings, and doing. Most of us as Christians spend a lot of focus on doing for others, and not necessarily in a servant mode, but in a benefactor mode. So when we are doing, we need to do as a servant. So our communication with God, do we give God our list of requests and petitions? Or do we, like Samuel, say, "Speak, Lord, your servant is listening"? Do you give as much time to listening to God as you do to requesting petitions? That's the balance. That is balance. And like I said, this is a place that I visit. I don't live there, but I'm trying to live there. So you have to keep coming back. And that's the same thing with meditation. You know, it's not so much that you focus on one word and you stay on one word or one scripture, but it's that you keep coming back, that you keep coming back. So you also have to balance your journey with self. You've got to face the demons or and the angels within you. God is within you. How does he speak? A still, small voice. You can't hear it if you're listening to everything else. You've got to have stillness. Scripture says, "Be still and know that I am God." You've got to be still. still. So I want to challenge you to the task of balancing the journey with God, the journey with self, and the journey with others. You know, some people are drainers, some people are fillers. You need to balance that. Balance it also with movement. Movement is critical to moving through your grief. I mean, and I can tell you, I've just lost my son recently, which is the second child that I've lost. And I still don't want to get out of the bed. But after the therapist said to me, you're licking your wounds and you still haven't healed, so you might as well get up and do something. And what I find is that when I get up and do something that helps other people, that it helps me. So again, understand the cycles, manage the grief, and balance the journey. I want to end with one thing. You all know this poem, The Dream Deferred by Langston Hughes. For me, it's what happens if you don't deal with your grief. What happens to a dream deferred? Does it dry up like a raisin in the sun, or fester like a sore and then run? Does it stink like rotten meat, or crust over like a syrupy sweet? Maybe it just sags like a heavy load, or does it explode? If you think of your dream as that raisin, you can nurture that raisin back, plump it up again with the water of the spirit. Little by little, you can plump it up. A dream deferred is a lost dream that produces grief. Treat it as such. Nurture it with joy. Be present to the presence and be present to the moment. That's it.
Chaplain Taylor, I'd like to thank you so much for that heartfelt presentation. I could feel it in my soul. How many of us have experienced grief? Without raising our hands, or if you want to raise your hands, you can, because I'm sure that all of us have experienced grief in one form or another. So today, I'm here to encourage you that we are stronger together. We don't have to deal with the grief alone. We have support systems available. Chaplain D. Taylor, keep on keeping on and keep on climbing. We're in your corner. I'm sure you know about intercollaborative care, and you are just on fire for the Lord. I have been encouraged, and I hope everyone else has too.
Thank you.
Next up will be Dr. Carmen Robinson. She has an appointment, and then after Dr. Robinson, we will have Dr. Angela Calendon. Dr. Carmen, you're up.
Good afternoon, everybody. I'm so honored to have been asked to participate in this panel today. Thank you so much for starting us off, Captain Taylor. I had my little red pen and I had been jotting down some notes. So this was helpful for me. You gave me some much needed reminders. So just a little bit of background. I am a family medicine physician, board certified, which means I could not pick what I liked best in medical school. I liked everything. I could not choose, so I chose family medicine so that I could do it all. I am trained in obstetrics and gynecology. I do women's health. I diagnose women with pregnancy. I take care of them through their pregnancy. I deliver their babies. Then their babies come to me. I take care of children from birth until they grow up. I take care of the parents. I take care of the grandparents and great-grandparents. I do end-of-life care. And for the purposes of this conversation, mental health care. Mental health is health. Part of what I do both professionally as well as my role as a Bible-believing Christian is to integrate healthcare, mental health care, and spirituality in total body wellness. And so that is the background by which I contribute to this conversation around trauma. So this is not gonna be a medical school kind of course. I actually didn't prepare a PowerPoint today. I'm gonna just sort of talk about my personal experience with trauma and then talk to you from a medical perspective on how we approach trauma and how it can hopefully help the persons on this call identify the trauma lives, or if you are someone that helps others identify and manage their trauma, how these tools could help you be better equipped to do that. So I'll speak a little bit about my journey of trauma. I mentioned I am a medical doctor. So that is 4 years of college, 4 years of medical school, and at least 3 years of residency, depending on what specialty you go into. Family medicine residency is 3 years. So after medical school, I did a 3-year intensive training on primary care. So I went to Wake Forest School of Medicine, which is here in Winston-Salem, recruited while I was in undergrad at Winston-Salem State University. I was recruited by the Office of the Dean. I received a full scholarship from the North Carolina Board of Governors, and I was excited to begin my matriculation at Wake Forest. And what followed was 4 but 7 years of hell. I spent 7 years in medical school. Medical school was only supposed to be 4, but I was in there for 7 years, where I experienced all kinds of micro and macro trauma, whether it be sexism, racism, outright deception that was levied towards me. I was kicked out of medical school. I was dismissed from medical school for academic progression. And it took the dean of the medical school meeting with me and letting him know all that I experienced from the different department heads or racist residents who were supervising me, letting him know what was going on in his school. And he ended up saying to me, Carmen, you're the type of person that we want to say graduated from Wake Forest. So he overturned the dismissal, the upholding of the dismissal from the appeals committee, and single-handedly reinstated me back into medical school, where I began to flourish. And I graduated with high honors, got into my top tier residency program, Baylor College of Medicine in Houston, Texas, proceeded to be chief resident at Baylor College of Medicine, my residency program, became faculty, became an assistant professor where I had the opportunity to train and educate other medical students and residents and future healthcare professionals, to where I am right now, which is the chief medical officer of Triad Adult and Pediatric Medicine here in North Carolina, where I oversee the clinical operations of 5 different clinics. So all of that to say, this is not, running my CV. This is not for accolades. I appreciate the snaps. I appreciate the kind words that you're putting in the chat. But the purpose of this is to talk about how my trauma journey allowed me to be where I am today. And part of where I am today is not just, overcoming the trauma that I experienced, but also educating others. So part of what I do outside of my role of CMO, I have Carmen Robinson, MD, where I am very honored to talk to pre-health students, namely pre-health students of color. So I have the privilege of mentoring students at HBCUs, PWIs who have expressed an interest in being nurses or physician's assistants or doctors, and helping them navigate what is an inherently racist system. We've come a long way. We have come a long way in our medical education, in reducing the racism that exists in medical education, but it still is there. There are still people in power who feel that we don't belong. And because they feel that people have escaped their scrutiny or somehow slipped in through the cracks, they have made it their duty to make that journey hard, almost impossible. Black and brown students are disproportionately at a higher rate of flunking out of graduate healthcare programs, of receiving low scores, receiving poor clinical reviews. And so I want to help these students, these pre-health students, these residents, navigate this racist system, teaching them how to flourish and thrive and get into the programs that they want, get in and get out, and then help the next person. So that's part of my passion. So I'm glad to be here. This is my background. The other thing I wanted to mention, I have always considered myself a high achiever, which is what you'll see a lot of in people who are in healthcare. You know, often they're the top of their class. And then when they get to these graduate programs, they're competing with everyone else who's the top of their class. We're not accustomed to recognizing we need help, much less asking for help. We think that if we are not succeeding, it's because we're not working hard enough. So I found myself doubting my ability. Oh, okay, well, I'm not getting the grades or the reviews that I want. That means I'm not working hard enough, because historically I associated hard work with achievement. There's always been a direct correlation with how hard I work, how hard I study, how much effort I put into it, my best effort, seeing the results that I want. But when you encounter a racist system, those efforts do not correlate with success in every case. And so what I found myself doing, I started out isolating. Okay, well, I can't hang out with my friends. I don't have time to hang out with my friends. No, I'm not going to go home this weekend and spend time with my family because I need to study harder. Obviously, I'm not studying hard enough. I did not correlate any of the trauma that I was experiencing with the performance that I was achieving in school, with the reviews that I was getting, with the grades that I was getting. And it wasn't until I was almost 2 years into this trauma that one of my mentors sat me down and said, listen, Carmen, have you thought that you might be experiencing depression or anxiety? I had severe test-taking anxiety, and I did not recognize it as anxiety. I thought that it was a lack of preparedness. And this is not something that was unique to me, and I didn't realize it at the time. I didn't realize that so many people experience the same thing. Mostly women and mostly people of color experience the same thing. And it wasn't until I finally plugged in mental health care services that I was finally able to recognize the diagnosis of depression and anxiety and get the help that I needed. The help being therapy. So I finally got a therapist, and I am not ashamed to say that I started taking medicine. Sometimes we need taking medicine. So this is just my journey. It's not unique, but it was significant for me because it took years of my life, 3 extra years that I suffered. We talk about, oh, what needless pain we bear. Oh, what peace we often forfeit. And yes, I took it to the Lord in prayer, but I also took it to my therapist and to my primary care doctor. And it was 2 years into my trauma that I was finally able to recognize what was going on and get the help that I needed. So now my duty is to educate my patients, educate my community, educate my family and my friends, my mentees about trauma, about mental health. Mental health is health, and how to stay healthy, or if you're not healthy, how to return to health. So just a few definitions that kind of inform my how I approach trauma. So trauma is a deeply deeply distressing or disturbing experience. It can be acute trauma. So you experienced violence, someone was violent towards you. It could be chronic trauma. So someone who is in an abusive relationship over years, over decades, and they continually have these acute episodes of trauma that result in a chronic traumatic experience. Or it could be something like a complex trauma. I think the best example of complex trauma that I can give probably, and we're all aware, is this pandemic. This COVID-19 pandemic has resulted in widespread complex trauma. We have people who have lost their jobs, people who have lost their homes, who have children that had to stay at home, and the parents, while working from home, had to also help their kids navigate online virtual learning. People who were dying from COVID-19 or had a loved one die from COVID-19. These are complex traumatic experiences. So we've got acute, chronic, and complex trauma. When we think of trauma in healthcare, there are lots of different types of trauma that I encounter in my patients. There's intimate partner violence, there's sexual violence, there's abuse, whether it's physical, mental, verbal, financial. There's systemic racism. There's trauma via socioeconomic status, personal or familial trauma, loss of health, loss of life, or the loss of health or life of a loved one, acts of terrorism. We've seen the most recent mass shooting. These are acts of trauma. War, natural disasters, all of these things are trauma that I see almost on a daily basis in my patients. And so as a result, as a family medicine physician, we have what's called trauma-informed care. And you see trauma-informed care not just on a medical perspective, but anyone who, pastors, mental health care providers, social workers, many of these professionals have or should be trained in trauma-informed care. And trauma-informed care is a whole person approach to healthcare that acknowledges the impact of trauma on health and facilitates long-term engagement in care that is inherently patient-centered. So that is a long definition that essentially says we assume everyone who comes into our door, who comes into our exam room, everyone has or is currently experiencing trauma, whether it's a micro trauma. So we talk about microaggressions, just those things that just fall under the radar. Oh, can I touch your hair? And then touching your hair. These are micro traumas that over time can build up into a macro trauma. So we assume everyone who comes in had or has been experiencing trauma. When we offer the care to our patients, we come to it from a perspective that there's no requirement for our patient to disclose their trauma. That has no bearing on our approach to trauma-informed care. It does not require that the patient disclose their trauma. And we use trauma-informed care as what we call a universal precaution. So everyone gets trauma-informed care. If you come in for, you're concerned because you think that you've been date raped, or if you're just coming in because you need your well woman exam, or if you're coming in because you have an ear infection, everyone is getting this trauma-informed care. And so part of it is the way we approach that patient. It could be things like warning the patient prior to asking any potentially invasive or potentially upsetting questions. If I'm going to take a sexual history for my patient, which I do routinely for all of my well woman exams, for all of my annual physicals, my well child checks, I'm going to do a sexual history. I'm going to take a sexual history. that could be potentially traumatic if someone has experienced a sexual trauma. And so part of it is warning the patient, hey, this is something that I ask everybody. It could be potentially upsetting. And if it is, please let me know. I apologize in advance. I just want there to be open communication. Asking permission before I initiate touch. Touch could be a traumatic experience because it could be a trigger. If someone has been on the receiving end of physical abuse or some sort of assault, that touch, my touch, could be a trigger. So I'm going to ask that permission before I engage in touch. I'm going to say, hey, I'd like to examine your heart and lungs right now. I'm going to use my stethoscope. I'm going to explain everything that I do before I do it and as I'm doing it. If I'm going to be doing a pelvic exam on a patient, even if it's not as a result of a sexual assault, if I'm not doing a post-rape exam, if I'm simply doing a well woman pelvic exam, I'm going to tell them, you know, this is not going to be comfortable, but I'm going to go slowly. I'd like for us to do deep breathing exercises, and I want you to communicate with me. If something hurts, let me know, I'll stop. So giving them that advance notice before I initiate touch. Using caring or sensitive language. So oftentimes, especially, you know, in some of my patients who have not come to the doctor in a long time, and they have white coat syndrome, they have stress coming in there, I'm going to use caring, sensitive language. Hey, I recognize that you seem a little stressed out. That's normal. Why don't we do some breathing? Some patients find that it's helpful to just kind of do some breathing exercises in and out. Let me show you how to do it. And I want you to match my breaths. Let's go in for 5 seconds, hold it, and out for 6 seconds. So using that caring, sensitive language is very, very effective when I'm engaging in trauma-informed care. And then one of the most important things is assuring that patient of confidentiality, especially if you believe or they have shared that they are about to disclose some sort of traumatic history. They need to know that what's said in these walls, with just a few caveats, but whatever is shared is going to be confidential. Now, if the patient says that they're about to hurt themselves, or if they're about to hurt somebody else, or if it's a child and they disclose that someone is hurting them, I let them know, hey, I do have to share this information with professionals or to the authorities, but everything else is just between me and you, and assuring that patient of confidentiality. It's important for trauma to be addressed, acknowledged, and treated, because even treated trauma, but especially untreated trauma, can result in chronic, complex medical conditions that, if you know, it could just snowball. So untreated trauma, treated trauma, but especially untreated trauma, can result in diabetes, high blood pressure, stroke, heart disease, kidney disease, mood disorders like depression, anxiety, insomnia, obesity. It can result in GI disorders. And even just kind of going a step further, sometimes symptoms of these issues is how we learn that there is a trauma. So oftentimes, some of these patients will come in with concerns or symptoms that really have nothing to do with trauma. They may come in and say, man, I've just been having this headache, Advil, Motrin, Tylenol, nothing, aspirin, nothing is helping. Or man, I just have this belly pain that just, you know, my bowels are not working. I can't, you know, use the bathroom. I'm having constipation, or I've been having this diarrhea. Or women may come in and say, yeah, it hurts to have sex with my partner, or having this pelvic pain that you really just kind of can't put your finger on the reason why. Everything looks fine. You do a pelvic exam, you do an ultrasound, and everything anatomically, it looks fine, but they're just having these occult issues. Occult meaning you can't pinpoint the problem. Chronic body pain, just not feeling yourself. I'll have patients come in and just say, I'm just feeling blah. I don't know why. I don't know what's going on. Can't sleep, can't eat. It can affect your mood, psychological symptoms that people are coming in saying, I feel depressed, or I feel anxious, or I can't sleep. Or if they identify their trauma, yeah, I was robbed at gunpoint, and every hour or every night I'm reliving this trauma. We call that PTSD, when you're reliving that trauma. These are symptoms that people come in, and they may be coming in for other issues. And while I'm taking their history, I've identified high risk behavior. So this patient is a smoker, or they're engaging in illicit drug use, or excessive alcohol use, or high risk sexual behavior, or disordered eating. And it's through taking this history, ruling out through lab work, through physical exam or imaging, that we realize, okay, we are dealing with untreated trauma. And so it's important that these traumas are addressed, acknowledged, and then treated. And Captain Taylor, again, I just thank you. You hit on a lot of how we approach treating the trauma and kind of the downstream effects of trauma. So obviously, if the patient has high blood pressure, we're going to talk about ways to treat it. If they have diabetes, we're going to talk about how to treat it. But we need to also think of depression and anxiety as another complex chronic medical condition. The same way I'm going to talk to you about healthy eating, exercise, and medication for your high blood pressure. I'm going to talk about that, about your depression. We're going to talk about getting a therapist. Now I'm going to stop and pause for a second and just kind of get on my soapbox. You all need a therapist. Everyone, if you hear what I'm saying, you need a therapist. You may think that I'm not talking about you because you have not been experiencing depression. You live a happy life. I am talking to you. You need a therapist. If you don't have one, you should get one. And depending on, it may just be like patients will come into me who have no medical history. They're not on any medication. They're just coming in for their prevention exam, their well woman exam. And I'm just doing a general wellness check. That may be what you need with a mental health provider. Or you could have significant, severe, complex mental health disorders that require more frequent visits to your mental health provider. Whatever the frequency is, you need a therapist. Get one today. If your insurance doesn't cover it, see if your job offers employee assistance programs. See if your county offers free or reduced cost or sliding fee scale mental health coverage, but get a therapist. If that's the only takeaway you have from here, it's get yourself a therapist today. So in addition to getting a therapist and seeing a counselor, and I'll also say, you want to make sure that the person that you see is specifically trained, a specifically trained mental health professional. And this is no slight to pastors, but not all ministers are trained mental health care providers. Some are, but your pastor, if you are going to him or her and they are not a trained mental health provider, then it is their duty to let you know you need to see someone who is licensed, someone who has been trained, who has received extra training and is certified to do this sort of work. There's nothing wrong with, confiding in a best friend or a trusted partner or a loved one, but there is something different about going to someone who has been trained to be objective, who has been trained to give you tips on how to treat mental health. So I think I've driven that point home enough. But in addition to mental health care, please also consider medication. Medication is an important part of wellness for the persons for whom it applies. And I am currently taking medication. I have depression and anxiety that will go into remission. And sometimes it could be a traumatic event, or it could just be the waxing and waning nature of depression and anxiety. But I am very transparent about the importance of medication in overall health for the people for whom it applies. And you don't know until you go to your doctor, until you go to your therapist, and they help uncover some of these unresolved issues. As a Christian and as a Black woman, unfortunately, what I see all too often is the religious or minority community disparaging mental health. And I'm so glad that we have this forum where we can just kind of talk transparently about the importance of addressing trauma and treating it. Too often we isolate or ostracize people. We call them crazy. We tell them they need to pray the demon away, or they're not praying hard enough. We question their relationship with Christ. We judge them. We delegitimize their disease. We scoff at therapeutic modalities, telling them, oh, you don't need to go. You just don't go. You don't need a counselor. Just go to pastor. We scoff at the recommendations of medical professionals or mental health providers, and people don't seek help until unfortunately it's too late. And so I am on a mission to change the narrative, to delegitimize mental health care, to let people know that everyone on some level experiences trauma, but help is available. And I want people to get better. I want people to experience health, wellness, and happiness. So that's my story. I'm sticking with it. You can visit carmenrobinsonmd.com if you want more of a one-on-one. If you have, nieces, nephews, mentees that want some more mentorship, they can fill out a form there. But I appreciate this opportunity to talk.
Thank you, Dr. Carmen. I appreciate that. Dr. Carmen is my schoolmate's daughter. I went to school with Beverly Robinson. Well, she wasn't Robinson then, but that's all I know about her, that she's Beverly Robinson. Dr. Carmen is Ted Odell's daughter also, and her mother will be speaking at 3:10. Dr. Carmen, you covered everything that I was wanted to say, and I just can't thank you enough. Everybody give Dr. Carmen a hand.
Very kind of you all. I really appreciate it.
May I quickly add, excuse me, may I quickly add that I put in the chat LOWS, which is a free mental health international program. It's Black owned and organized. For those who are interested or want to check them out, it's in the chat.
Excellent. Thank you so much, Rosemary Wilson Murray. Rosemary Wilson Murray is also my schoolmate. So she will be speaking later, and I will be doing her bio for you. So can we keep our questions and suggestions till the end? But I do appreciate that. Rosemary, Miss Murray, she's a great schoolmate of mine. She looks young, but we've been together we've known each other since 1974, 47 years almost. And her and her husband have a great team. You can team up with them, at a time that's convenient. Okay, next we will have Angela Callender, Dr. Angela Callender, because she has expressed great interest in helping us. And again, I can't emphasize it. I just can't emphasize it enough. While Sisters for Sisters helps women to connect, I help people to work towards intercollaborative care and being stronger together. That's what this is all about. Pulling together, because we have help available for us, whether we have vicarious trauma, whether we feel insecure about anything, we can work this out together. Dr. Angela Callender is a member of the American Naturopathic Medical Certification Board, and she's a board certified doctor of natural medicine. She's also a nutritionist and a master herbalist, or herbalist. She has over 25 years of experience as a national health consultant, using natural herbs, minerals, and vitamins to assist clients in healing the body for a healthier lifestyle. Dr. Angela Callender is also a graduate of Trinity College of Natural Health and the Institute of the National Association of Certified Natural Professionals. She also has a PhD in Christian leadership from the School of the Great Commission. When Dr. Callender is not speaking, writing, or evangelizing, she provides health consults and personal health plans that utilize holistic therapies, homeopathic remedies, and herbal supplies in combination with nutrition and lifestyle counseling. She does this in order to address the full dynamics of an individual's healthcare. Dr. Callender is a stalwart voice of faith and inspiration. Can everybody mute their mics if they're not?
Come on in. Look at me.
And we thank you for participating, but please mute your mics so that we don't get the background feeding. I have just a couple more things to say. As an evangelist, Dr. Callender has answered the call to speak to nations regarding self-transformation. She speaks to the youth, men and women, about using intentional wellness strategies to create a desired and fulfilling life. She speaks on topics that elevates thoughts to help people overcome emotional pain, mental and physical abuse, and to be set free from spiritual bondage. In addition, Dr. Callender is passionate about speaking against domestic violence and is an advocate for victims' rights. Ladies and gentlemen, I'm still getting feedback. If you could please mute your mics, that would be awesome. It would be greatly appreciated. Thank you in advance. Dr. Callender's passion and love for people has inspired her to write. In addition to her autobiography, she has written several other genres, including a devotional ebook. This devotional ebook is written in conjunction with a child's storybook. Dr. Callender has spoken in churches globally. She motivates her listeners to prevail and prosper despite their circumstances. She promotes next level living through Jesus Christ, our Lord and Savior. Her speeches are life-altering and penetrate the soul. She is gifted with a healing and prophetic anointment. Without much ado, feel free to listen to Dr. Angela Callender.
I believe she dropped off, and she should be back shortly.
Okay. In the meantime, we will have my esteemed friend, another one of my esteemed friends, Dr. Angela Pitts. Dr. Angela Pitts was born at White Memorial Hospital in Los Angeles, California, to John and Sarah Pitts. Angela and I met over 10 years ago at a church in Bowie. And she's an outstanding optometrist. Angela's parents are John and Sarah Pitts, and they have been Seventh-day Adventist missionaries. At the age of 5, Angela announced to her parents, "I want to be Dr. Angela when I grow up." Let her mother tell it. This pronouncement was repeated throughout her childhood. Her parents, John and Sarah Pitts, received a call from God to work wherever their services were needed. As a result, they moved to places where God led them to go in his field without question and or hesitation. Needless to say, the family moved quite a bit. Every few years, the family relocated across the country from California to Tennessee, to Colorado, and then outside of the USA. Before 10 years of age, Angela lived in 5 states. After these moves within the states, her parents accepted a call to move overseas. The parents spent 6 years as missionaries in Sierra Leone, West Africa. That was a life-changing experience for everyone in the family. Angela grew up with other missionaries from multiple countries, as well as learning the language and the culture of Washington, D.C. metropolitan area, otherwise known as the DMV. She did this with her husband, David, who was her high school sweetheart at Pine Forge Academy, and with her beautiful daughter, Margaret.
Thank you, Maxine. Thank you.
You're welcome, Dr. Angela Pitts. Okay,
I'm going to share the screen and put up my PowerPoint. Thank you so much for inviting me to this forum to discuss something that is oh so needed. And I'm going to talk about what I love to talk about the most, and that's eyes, and how it is related to trauma and how you can have trauma. And I chose this picture right here with the eyes crying because that when you have trauma, it comes deep inside and it comes out in tears. And tears are a way of just, not only does it physically wash your eyes, but it helps to actually wash you emotionally when you cry. So tears are just a wonderful thing. So that's why I start off with that picture. Vicarious trauma, let's talk about it. Somebody comes into me, this is what I may see. If they've been through, like Carmen has talked about, the things that they have to go through. And from the point of view of the eyes, it can have major damage to their eyes. Of course, their emotions and everything else, but I'm coming at it from the point of view of the eyes. The things that you see most are a black eye, or bleeding inside the eye, or actually broken orbital bone, which is the bone around the eye. And this person had all 3 of those. This person was severely damaged from trauma. And the bone, there's an x-ray below it showing how the bone was just totally shattered. Those little bones around the eye are very, very fragile. And a fist hitting that can just totally shatter those bones. And a person can actually totally lose their eye from that. Fortunately, that was not the case with this young lady, and she was able to have plastic surgery, and it's not apparent, at least on the outside, what all she's been through. I would like to transition to just talking about eyes in general, how to keep our eyes healthy. This is one of those things I like to get on the soapbox about. I like to shout it from the mountaintops, make sure every person knows this. So how to keep our eyes healthy. This is one of my favorite books of the Bible, text in the Bible, because it's Jesus talking about the eyes. And of course, he's the one who created all of us. And so he, in this text, tells about the eye, and it talks about the eye spiritually as well as how the eye actually functions. So this is what a schematic of an eye. An eye is actually an eyeball. It's actually round. This is kind of what it looks like here. And if you kind of take a slice through the inside of the eye, this is what you see. And so just like the Bible text says, light comes in through the eye, and that's how we see. And it comes through the clear part of the cornea, then it goes through the iris, which is the color part of your eye. There's a dot in the center called the pupil, and that's where the light goes through, and then it goes through the lens. And if all of those things are clear and healthy, then a person sees well. If any of those are not clear and healthy, then the person does not see well, and as the Bible text says, it's dark inside. Even though light is a wonderful thing, we see with light, I want to remind everyone as we're going into summer, please wear sunglasses. Protect your eyes from the sun. The sun causes damage to our eyes that can be permanent damage. So please make sure you wear sunglasses whenever you're outdoors, and make sure the glasses have ultraviolet protection to protect you from the damaging rays of the sun. How often should you get your eyes checked? I hear that often. Every person should get their eyes checked regularly. Adults every 1 to 2 years. Children, since they grow and change so much, they should have their eyes checked yearly. It's best to get children's eyes checked in the summertime, so that way if they need glasses, they can get the glasses in the summer, adapt to them, and then be ready when the school year starts. So any of you who have children or grandchildren, please make sure that they get their eyes checked, especially now the summertime, so that they're ready for the next school year, because poor vision can cause a child to not do well in school. So that's another one of those things that's just so important to me. The family doctor or the pediatrician does check the eye, but that is not the same as a complete eye exam with an eye doctor. So please ensure that your children get your eyes checked regularly. Injuries in the eye. Besides domestic abuse, there are other injuries that can happen in the home. And majority of these injuries could be avoided if a person used eye protection. So just like doing yard work or it's working on the car or even art projects, the eyes need to be protected, because something can come up in the eye and before you know it, something very catastrophic can happen. So it's important to have eye protection. Make sure you have this in your home at all times. A couple of pairs of protective eyewear whenever you're doing anything that can cause damage to the eyes, because trauma to the eye can be devastating and can cause permanent vision loss. There are systemic diseases that cause major trauma to the inside of the eye. And there's a lot of diseases out there that do that. But the top two that cause damage to the eyes the most, and the diseases that we all are very familiar with, and that is diabetes and hypertension or high blood pressure. This is just a quick look inside the eye. The first picture shows that if you're looking at somebody, you see their eye, you see the eye, the almond-shaped eye. Below that is what it looks like when you're looking inside of a person's eye. You take a slice through the eye, and that's what it looks like taking a slice through the eye. The picture on the far right is the view that the eye doctor sees looking in through the pupil. So I wanted to kind of give you a perspective by this drawing, because when I show you the pictures a little bit later on, I'm going to show you pictures of the actual inside of the eye. I want you to get a perspective of what you're looking at. So it basically is looking through the pupil, looking straight back into the eye, into the back of the eye called the retina. Okay, hypertension. When a person has high blood pressure and the blood pressure is not controlled, it shows up in the eye. And the first picture there, you see that the blood vessels are very kind of squiggly looking. If we point to the one vessel here, is the one vessel that kind of actually looks somewhat normal. Most of the blood vessels in the eye look kind of like that if a person does not have high blood pressure. If a person's blood pressure is not well controlled, we'll start seeing changes in the blood vessels, and this is one of the changes that's most obvious. On the other side is another picture that you can see that the blood vessels are tortuous, is what we call it, but they're kind of twisty. So that's the early sign of high blood pressure changes in the eyes. If the person continues to have blood pressure that is not well controlled, it shows more problems inside the eye. And as you can see, that eye looks extremely abnormal. Even if you do not know what an eye looks like, that eye, you can tell that is not a normal looking eye. That person's actually starting to have some vision problems because of their high blood pressure. Now, the picture over to the right, just looking at it may not seem that bad, but there's a little shiny yellow spot down towards the bottom. That little spot it means that this is an urgent problem. That is called a plaque. And that is what breaks off in the blood vessels and can travel to the brain and can cause a stroke. So if we see this in the eye, we call 911 immediately and send that person to the hospital, because that is a warning sign that this person is about to have a stroke. So once again, the eyes are the window to the body. This, if a person walks in like this, they feel fine, I'm doing fine. And then you look at this and it's like, no, you really need to go to the emergency room right away. So the Lord is so wonderful how he makes our bodies so perfect. And one of the little pieces of trivia that I love to tell people is that the eyes is the only place you can actually see blood flowing through the blood vessels without it being invasive into the body. So it's really the window to the body. If the eyes are healthy, if the blood vessels in the eye are healthy, then the body is healthy. If the blood vessels in the eye are unhealthy, then that shows that there are other problems inside the eye, outside of the eye, in the whole body. Our next picture is severe hypertension. This is like the ultimate of trauma to your eye from high blood pressure that has not been controlled. And there's bleeding everywhere. This person's vision is quite reduced, and they have had blood pressure uncontrolled for a very long time. And really, from the point of view of the eye, there's really not much you can do about these things. And so when we see these things happening in our patients, we really keep telling them, please go back to your doctor and do everything you can to get your blood pressure controlled, because you can end up having it turn out to be something like this, which can cause irreversible damage. Diabetes has some similar things. On all over the first one is the back of the eye, the fundus of an absolutely normal looking eye. I wanted to remind people what that looked like after looking at that horrible picture a few minutes ago. That's what a normal eye looks like. And the center of your vision is that part right there. That is the center of the vision. That's where you see straight ahead. And then all around is the side vision. So a person can have, like this next picture over here, there's bleeding, and that's around the optic nerve. But the part of their vision where they see clearly, there's only a little touch of blood getting close to it. So this person may walk in and say, oh, my vision looks a little bit blurry, but I think I'm doing fine. And you ask them, well, how is your diabetes well controlled, your blood sugar controlled? Oh yeah, my blood pressure is just fine. My blood pressure is fine. My blood sugar is fine. Then you look inside the eye and I see this, and I can tell right away that this person, their blood sugar is not well controlled, because it takes time with the blood sugar being uncontrolled to see blood bleeding inside the eye. So once again, that is a way to inform the person, please go back to your doctor and do everything you can to get your blood sugar controlled. In the early stages like this, if the blood sugar becomes controlled, this is reversible. If it gets a lot worse, sometimes a person can have permanent damage. And diabetes is actually the #1 cause of blindness in people under age 65. And it's sad because we see blindness in young people, even in their 20s and 30s, because they've not kept their blood sugar controlled. So further on in the disease, if they are continuing to not have their blood sugar controlled, you can see that the eye begins to look even more abnormal. And the blood is leaking out, and there's these areas, there's white spots are abnormal as well. All of these are signs that the blood sugar is just way out of control. And if they continue to leave the blood sugar uncontrolled, this is what will happen. I've had patients call up and say, I woke up this morning and all I see is red. What shall I do? Come in, and this is what we see. They've got bleeding inside their eye. This may be permanent. This person may be not able to get any vision back. They may be able to get some vision back, but the problem is that so often people with diabetes don't wake up to the fact that they are not taking care of it, and they wake up too late, and by then they already have irreversible damage to their eye. So this is the ultimate of trauma to the eye.
Yes.
Also, just to mention that sometimes I didn't show a picture of the inside of the eye. Even trauma, external trauma, such as a fist hitting the eye, can also cause the inside of the eye to look similar to this as well. It can cause bleeding inside the eye. So trauma from the inside or trauma from the outside can cause bleeding inside the eye. And that is an emergency situation. And this person is in at risk for losing their vision. So I stress to anyone who has diabetes or high blood pressure to please keep their blood pressure and their blood sugar under control, because if they want to have good vision for the rest of their lives, the only way to do that is to keep the blood sugar and blood pressure under control.
Amen. Amen.
So I will just end back with my text that I like so much. I took that picture of the sky. I thought that actually looked like an eye in the sky. So, so I put the Bible text on that picture because to me it looked like an eye looking out at me. But I just love the eyes because they say so much about a person, looking at the outside and the inside of the eye. Yeah, so much of the health of somebody you can tell from their eyes. So the take home from this is, please take good care of your eyes. It's so important to not ignore your eyes. So many people say, oh, I've got good vision, I don't need to get my eyes checked. Yes, you do. The eyes must be of top importance. Nice to speak to you all. Thank you.
Amen. That was great. Absolutely great.
Thank you, everyone. And thank you so much, Dr. Pitts.
Yes.
Dr. Pitts, Carmen, Dr. Robinson, Beverly Robinson, and Odell, we're all friends from school and church. So we're a team. My point, however, is that we're not exclusive. We're an inclusive team.
Yes.
Okay. We're stronger together. That's exactly what I'm covering. Heart attack saves lives if it's mediated early. Dr. Carmen knows this. We all know this. Dr. Angela Pitts illustrated it clearly. My website, Heart, Health, and Home, is about that. You can receive a book that I'm publishing within 30 days. The title of the book is The Language of the Heart, Importance of High Blood Pressure Management.
Yes.
As a doctor, I am among the 5% of nurses who has achieved their Doctor of Nursing practice. I've experienced some of what Carmen experienced, but not to that degree. I must say I am truly encouraged. We now have a platform called DOCs, which is Doctors of Color, where they advocate for women to go out, serve, and help others, and to grow to the best of their ability.
Amen.
With this in mind, I was informed by Dr. Callender that she accidentally dropped off, but Dr. Callender is back. Dr. Callender, would you like to go ahead and inspire us about ways of handling traumatic incidences such as vicarious trauma? Are you on? Okay, we will go to, she had another appointment, so we're really thankful that she could be with us, but she may be back by 3. In the meantime, we will have, yes, are you there?
Yes, I'm here.
Oh, I'm sorry.
Yes.
You have another name. You're called Kathleen Boudou. Now, see, that's not fair. I only know you as Dr. Angela Callender. I'm sorry, Doctor. Please go ahead, Dr. Callender. Take it away. And thanks for sharing.
Oh my goodness. I just want to thank you for having me on this platform. I have to, I'm part of Sister for Sister Network. I thank you, ladies. Thank all my sisters. I love you all. I tell you, the eyes are the window to the soul. So thank you for that extraordinary presentation. When you were given that presentation, the young lady before that, I remember I had a trauma to my eyes, and the doctors told me that I if I'd waited a little longer, I would have been blind. But praise the Lord, I can see. And so, yes, the eyes are indeed the window to the soul. But I want to talk about trauma, and I wanted to tell a little bit of my story. I was born in Guyana, South America, in poverty. My mother had 18 children, 8 died. She had us all. I think I was the only one that was born in a hospital. But we all know that, you know, poverty is trauma in itself, you know, but growing up, my mother had a secret, and she knew how to take care of us naturally. She knew how to go out and boil the leaves and things like that to heal us.
Okay.
Can you guys hear me?
Yes.
Yes.
Yeah, and that's so she did. And so I managed to come to America. And again, when I was 15 years old, I went to a job, and I was brutally raped by a person that my mother trusted. And so there comes another trauma in my life, and on and on. So, but I want to talk to people about counseling and what you feed your mind. I'm here to speak to the people that have gone through trauma, rape, abuse, abandonment. You know, I mean, sometimes you get, you know, when you've gone through that kind of trauma, you know, you have to get a hold of yourself and just go into your quiet place and just say, God, just help me. I do believe in counseling. When I was going through my trauma, I went to a Christian counselor. I also went to the pastor of the church who he and his wife counseled me. So to the people that have endured trauma, that are going through trauma, reach out to your church to see if they have counseling. You know, reach out to you know, if you have insurance, reach out to the places where you could get free counseling. You know, I mean, if you have trauma, you get ill. You know, healing is spiritual, physical, mental, and emotional. So I at first I advise people, you know, go to the Lord, pray. Spiritually, there's healing in spiritual. Corey Ten Boom said there's no pit where Jesus can reach his hands and find you and grab you out of that pit. You know, sometimes when we endure, it's hard. Our life, you know, there were so many times when I wanted to commit suicide. I didn't want to live. But then there will be someone that would reach out to me and say, Doc, what are you doing? There are a handful of people that you have in your circle that you could trust. Reach out to them. Reach out to them. Let them in if you're enduring trauma today. Open up and let someone in that you feel like you can trust. Don't be alone. Do not be alone. I don't know if you guys are hearing me.
We can hear
Hello?
you.
Yeah,
Yes. Yeah, and yeah, don't be alone. Reach out to people, talk to someone, tell them what you're feeling. You know? And I tell you, with me, I am grateful that I have, you know, I have sisters too. I was able to turn to my family. Silence is a killer. Do not allow your grief to take control of you. I went and I would Google things on my TD Jakes. I would listen to pastors. At one time I wasn't able to afford counseling. I went on the internet and I Googled motivational speakers. I listened to people who would pour into me and empower me. And that's free. If you're dealing with health issues, the body is not complicated. I advise people that are going through health issues to know your blood type. That's one thing that, you know, when you know your blood type, you could eat according to your blood type. That too, you can Google and see how to eat for your blood type. Again, with my trauma, I meditated and I did not allow myself to think that I wouldn't make it. Throughout all my trauma, I would go under a tree. I would listen to the birds. I would listen to nature. I would embrace nature. And I would just talk to God. For those people that are going through trauma right now, I'm speaking to you. I would listen to the birds, the music of birds, and I would just self-talk myself. You're going to make it. I told myself that I'm not going to die in this mess. I must make it. And then I fasted and prayed. I did a lot of fasting. And then I had a vision to write my book, and that's how, and books after books, God began to download in me. So I want to say that the rejected stone is indeed the chosen stone. And Dr. Robinson was saying how what she went through, but look at her, look what God used her to do today, what God is using the speaker on this platform to do. Throughout your trauma, he's using you now today to empower others. So I encourage you to just hold on to your faith. Hold on to your belief. Joseph was rejected. He was by his own brother, but God was preparing him for the palace. Allow God to reintroduce you, rewrap you and reintroduce you to your brothers. And God can do it. He's a God of miracles, signs and wonders, and believe him today. I was born in a Hindu home. I married a Muslim. And then I experienced Jesus Christ, who changed my life. I encourage you to have hope, renewed hope today, that you are going to be well. Believe in you. Believe in your God. Believe that you can and will overcome. If you have any questions for me, you can reach out to Peggy, Sister for Sister, or me. And I want to say to you guys, I love you very much. And trauma does not have to be your final destination. There is hope and there is help. The body can heal itself. If you're going through any sicknesses, any ailments, watch what you eat. Our mouth is not a garbage can. You are what you eat. Drink your water. I know liquid chlorophyll is something powerful that I love. If you guys know about liquid chlorophyll, purchase a bottle of liquid chlorophyll and add it to your water. Drink it. It cleanses your digestive tract. Supplements are important for us. I will give you the analogy of fish. You know, when you go fishing and you take a fish out of water, it flatters. It is because you take it out of its natural element and it flatters until it dies. Same with us humans. If we do not get the nutrition and the supplements that we need to live, we will flatter and die, which means we're going to get diabetes. We're going to get cancer. We're going to get all those ailments. We can prevent diseases. We can keep ourselves healthy. It's our choice today to make. We cannot be pitiful and powerful at the same time. We must choose one. And today I ask you to love yourself. Look into that mirror and say, enough. I've abandoned you, self, enough. You can do great things. Whatever it is that you want to write a book, whatever it is, you could still do it. Your daddy is Jesus Christ and he owns the universe. With that in mind, I want to say that I love you guys. And if you have any question, again, reach out to me. And I thank you for having me on this platform.
Thank you so much, Dr. Calendar.
From
I-
the wireless house.
I also am a lifetime member of Sisters for Sisters Network, Inc. And I'd like to thank
Yes.
Peggy for inviting me and for hosting all of us.
Yes.
I owe a great debt to Peggy. She helped me to get notoriety from the state, from Barbara Robinson, state senator, for holding 4 health fairs in a month for my graduate degree in nursing. I also owe a great debt to every one of you here because everyone's been through vicarious trauma in one form or the other. Hopefully today we can take some notes on finding ways to be stronger together. We can do this. And there's lots of intercollaborative care for you. I say that because it's so joyful to see everybody in the ring. I can see Beverly Robinson. She's definitely a fighter. Hi, Bev, glad you could make it. Your daughter tore up, girl, and I know you're gonna do the same.
Oh, praise God.
Yeah, thanks so much to, I'll call your husband Pastor Robinson, Odell Robinson. Ted's been amazing. Next up, we have Angela Dixon Watson. Angela Dixon Watson is the author of the book, Gift of Another Breath. You have pancreatic cancer. Much of what Dr. Calendar has said supports what Angela Dixon Watson is about to say about pancreatic cancer. Bev, give us a few minutes, okay? Please. Everyone's been so involved and excited that we've run over a bit. Angela Dixon and Rosemary. Angela Dixon Watson is a pancreatic cancer survivor. She is passionate about increasing awareness of pancreatic cancer and its subtlety. She started experiencing itching in the palms of her hands, which graduated to her entire body, except for her face. She then became jaundiced and had rapid weight loss within a 4-week period. These symptoms could have meant any other illness, but since she had not experienced this before, and since she didn't have expertise in this medical field, she immediately sought medical attention. We are stronger together, folks. If we need help, let's reach out. Together we win. Angela is encouraging you to pay attention to your bodies. It speaks to us. Only about 15% of people diagnosed with pancreatic cancer make it to surgery. Alex Trebek is one of the people that Angela has reached out to who also had pancreatic cancer. He is not with us today, but we pray for everyone who is experiencing vicarious trauma through disease, through rape, through emotional abandonment, through parental abuse, any type of trauma. Let's keep hoping and reaching out. Angela Robinson's hope is that with more funding and research for early detection, that the survival rate will be increased greater than 10%. Her desire is that you will be encouraged from scriptural and song references throughout her journal, and for you to hold throughout her journal, she illustrates that it's important to hold on to HOPE. Let's hold on to hope together. Angela grew up in a Christian home in Jamaica, where she learned the values of trust and faith, spending early mornings in worship before heading off to Harrison Memorial High School. She graduated from Northern Caribbean and Washington Adventist universities. Her main career path was working in administration at both the World Bank and the International Monetary Fund, also known as the IMF. She has two wonderful children, Roosevelt Delano and Raquel Ann. Her two grandchildren are Sierra Rain and Chase Alexander Burke. Her husband is Ira Watson. Everybody, let's hear Angela Dixon Watson explain how she got the gift of another breath, even though she had pancreatic cancer.
Thank you, Dr. Marsh. Can you hear me?
Yes, you're welcome.
Okay. Yes, thank you, Dr. Marsh, for inviting me to be a part of this program. I'm deeply grateful and honored. And before I talk about the trauma I experienced in 2016, here's a pop quiz. True or false? Is there a simple test you can take to determine if you have pancreatic cancer and to find it early? The answer is false. There is no established way to test to find pancreatic cancer early. To get reliable information on possible symptoms and risk factors, please check letswinpc.org, letswinpc.org. Okay, I survived the trauma of pancreatic cancer by holding to God's healing scriptures, holding on to God's healing scriptures. I've never stopped speaking healing scriptures over my life. And I'm grateful for the prayers of family and friends. 2 Corinthians 1:11 says, many will give thanks on our behalf for the gracious favor granted us in answer to the prayers of many. Imagine hearing heart-stopping words. You have aggressive pancreatic cancer already in your lymph nodes and you have up to 6 months to live without treatment. And with survival rate statistics racing against me, under 8% makes it to 1 year. I promptly wrote my Celebrating the Life of Angie program and identified participants. As Dr. Marsh said, in March 2016, I had my annual physical and walked away pleased that I was in perfect health. Surprisingly, about 4 weeks later, April, I suddenly started experiencing 4 symptoms: jaundice, rapid weight loss, and I was not dieting. Sudden onset of diabetes and itchy skin, which started in the palms of my hands, and the itching graduated to the rest of my body. My husband, Ira, told me that he heard me crying out at night, I can't sleep. Tests were ordered, including endoscopy, which showed that I had duodenal cancer, not pancreatic cancer. However, it was during surgery, rare and aggressive neuroendocrine pancreatic cancer was discovered. And it was already in my lymph nodes and rushing through the stages. I felt blindsided. Scripture says the angels of the Lord encamps around his worshipers and delivers them, Psalms 34:7. After surgery and recovery, treatment options were discussed and I opted for chemo and radiation. I did not have the luxury of time to only do herbal. However, I combined both. I survived taking daily doses of chemo orally, 2,500 milligrams every day, plus once weekly on Tuesdays, infusion of another drug, 1,000 milligrams through my port for 7.5 months. And added to the mix was 5.5 weeks of daily radiation with weekends off. During treatment, I felt like I was in a shipwreck tossing about on a raging sea. Moments like those forced me to speak Psalms 107, verse 20. He sent out his word and healed them and snatching them from the door of death. Some days infusion was challenging when my white blood cell count was too low for my regular chemo dose. And during these lonely days at the infusion center while sitting in the chemo chair or lying on the radiation table, I often listened to different songs, but the main one was, oh God, in shady green pastures, so rich and so free, God leads his dear children along. Yes, there were days when I doubted my longevity because survival rate statistics was fighting me. So Psalm 6 verse 2 came to my rescue. Have compassion on me, Lord, for I am weak. Heal me, Lord, for my bones are in agony. This was a spiritual and physical warfare, and I strengthened my bones by listening to narrated healing scriptures and songs. And no further harm came because God kept me sheltered in his arms. One of the scriptures that kept me positive during treatment was Proverbs 18:21. The tongue has power of life and death, and what we speak, we get. When I started taking chemo, I used to say, well, I'm going to take my poison, but God quickly changed my language to, I'm going to take my healing medicine. And oftentimes I'm asked, Angie, how are you doing? And my mantra is all is well, which is my way of using my mouth to plant ongoing healing seeds. In addition, I'm fully aware that I'm still on the battlefield. As a result, I continue to drink my herbal teas and smoothies, and I often speak before drinking. Let the healing waters flow through my body. This is a supplement, but God, you are my healer. And since a positive mental attitude is a key to healing, I often meditate on Proverbs 4:23. Carefully guard your thoughts because they are the source of true life. So I don't use the word remission because psychologically it makes me feel as if I expect the cancer to return. And on my diet, on a spiritual level, my nutritionist is Jesus, the water of life. In the natural, however, I'm not a vegan or vegetarian, no labels. I'm careful what I eat. I prepare soups, use herbs, ginger, aloe vera, moringa, whatever I have at home. I'm not an expert in this arena. On staying physically active, I enjoy exercising to songs which represent my life. For example, there's a song, He lifted me out of the miry clay and planted my feet on the rock to stay. And that is the reason why I sing and shout, for Jesus came down and he lifted me out. About my book, during difficult treatment days, I started jotting down notes on an ad hoc basis for my two grandchildren, Rain and Chase. And friends were relentless in their encouragements. In addition, I was made aware of a post my son had on Facebook. And I'm sure his sister Raquel Ann, who was born with severe cerebral palsy, would have agreed with what was said. Here's an excerpt. My mom had Whipple surgery last month. Today we have found out the cancer has spread and she's battling pancreatic cancer. I have to hope that my mom can recover even though the odds aren't good. What's worse? Losing a parent in the blink of an eye or watching her slowly leaving you. And my book, Gift of Another Breath, You Have Pancreatic Cancer, was published in 2017. I included scriptures and songs which watered my soul during 7.5 months of chemo and radiation. So let's fast forward to my completion of 7.5 months of treatment. My God stepped in, and my first no cancer report was on April 4, 2017. Look at the hand of our God. For the past 5 years through July 2021, I received 12 reports as follows: thyroid, heart, bones, normal, no disease in the chest, liver, abdomen, pelvis, adrenals, spleen. Bottom line, no new, no progressive, no metastatic disease found. A member of the radiation oncology team said that in 15 years at that hospital, I went to the University of Maryland Hospital in Baltimore, that in 15 years at that hospital, she witnessed only 3 people who made it to 5 years, and I'm one of the 3. She also said that my scan was so clean, It's as if I never had cancer. And my regular oncologist kept saying, it's a miracle. She's the person who told me I had up to 6 months to live without treatment. And negative whispers from the enemy are ongoing in reference to my longevity. So to maintain my sanity on a daily basis, I keep speaking Nahum 1:9. Sickness and disease will not rise up a second time. That's not my destiny. Since April 2017 to present, I've been off all the crutches of all man-made treatment plans of drugs and radiation. Only 10% successfully completes the treatment plan. In 2016, when I was diagnosed, it was less than 10%. So now, thank God, because of funding. So only 10% successfully completes the treatment plan and makes it to 5 years and beyond. And I consider myself blessed to be in the 10% club. From a possible up to 6 months, now heading to my 6th year. There's a song which says, the God of the mountain is still God in the valley. When things go wrong, he'll make things right. And here's great news. It is possible that I will be discharged from yearly monitoring in 4 weeks because there's no standard protocol to keep seeing me because I don't have cancer. I believe that Exodus 15:2 applies to me. The Lord is my strong defender. He's the one who has saved me, and he's my God, and I will praise him. Why am I still here against survival statistics? You may get an answer by viewing my 3-minute video on YouTube titled, I'm Still Here. In closing, why do I share my traumatic journey? My desire is that my testimony will rekindle a glimmer of faith and hope in the life of someone who has been diagnosed with a terminal illness, and to spread assurance that God's healing promises also apply to them. Jeremiah 30:17, I will restore health to you and heal your wounds. My timeline was up to 6 months without treatment. I'm holding on for dear life to Isaiah 40:31. But those who trust in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not faint. I believe that I was saved to serve and to be a living witness to proclaim God's healing mercy and grace to anyone who will listen. Thank you for the opportunity to share.
Oh, outstanding, Angela. Sister Dixon Watson, you're amazing. We worked together in 2019 when I had a God's Gifts of Love and Healing. So today, Angela again is helping us to be exemplified in that we're being uplifted by her testimonies of love and healing.
Thank you.
Today, as you can see, we examine vicarious trauma, and it's not over yet. We have 2 more presenters, so we'll go as quickly as we can. Please bear with us. So what is vicarious trauma? It is reliving bad memories of the past, and it can promote attention deficit disorder, depression, and anxiety, as Dr. Carmen Robinson already said. My goal today was to illustrate the importance of how vicarious trauma can affect us: 1, physically; 2, mentally; 3, spiritually; 4, socially; and 5, financially. Health is wealth. My second point is that in terms of physical abuse or physical trauma, Dr. Angela Pitts illustrated how the eyes are the windows of our soul, and how they not only illustrate any type of health trauma that we're experiencing, but they also illustrate physical trauma. Mental, spiritual, social, and financial illustrations will be given later. But next, we'll have Beverly Robinson tell us about some of the physical, social, and spiritual and mental anguish that she has faced. Her book is called Can everyone see this? My name is Alvonia. And the name of someone is really important. So let's hear Beverly, my former schoolmate and Dr. Carmen Robinson's mother. Take it away. Show us, Bev.
Thank you so much. And I'm just so humbled to have been included on this panel of powerful experts and these powerful sisters. And thank you so much for including my daughter, Dr. Carmen Robinson. Um, what you all have received from her today, I receive at home. She shares all of this knowledge, and she's very, very fierce. My daughter's fierce, and she's passionate. And to have gone through what she went through was like double trauma for us when she was at Wake Forest. But we went through it together. Also, I was so grateful to see Dr. Angela Pitts, my sister. So glad to see you, and our prayers continue to be lifted for you, as you know. And there's nothing like being supported by your significant other, my husband, Ted, as you all know him, Odell. He has always been I introduce him as my priest and my pit bull. You need someone who will pray for you, and you need someone who will advocate physically for you if necessary. I have to let you all know I do come from the hood, and my husband will step up for me, and I'm so grateful for that. Let me say this, Sister Rosemarie, I love those Bantu knots. I'm a big fan of, I'm a huge fan of ethnic hairdos, as you all can see. It will take women to save women. It will take sisters to save sisters. Not taking anything away from the men. We need the support of men, but throughout history, women have saved women. Sisters have saved sisters going back to biblical times. Women stood up for women. You think of times during slavery, those sisters saved those sisters. Even when you think of during civil rights time, sisters saved sisters and their entire families. And even now, we need our sisters to save one another. Hello, Carmen and Carson, my daughter and my granddaughter are back in the pictures. We are just always on the run. I had to cut out, I didn't get to hear everything that was said earlier because I was on an earlier Zoom. Now, this topic of vicarious trauma and moving into the palace, getting rid of the luggage, the part that stood out to me was moving into the palace. Too many times we think that moving into the palace means dying from this earth and moving into the kingdom. I do believe that our palace can be right here on earth. We do have to move that luggage out of the way in order to move into the palace right here on earth. And recovering from domestic violence, I am a victim of domestic violence. A lot of people don't realize that sexual trauma is domestic violence. They won't acknowledge it or they won't recognize it, but sexual trauma is domestic violence. And I am a survivor, a happy survivor of sexual trauma. And also emotional abandonment is trauma. I was emotionally abandoned by my mother, who knew that the sexual trauma was happening at the hands of my stepfather. One of the things that we have to acknowledge is that the relationship between a mother and a daughter is sometimes very, very complex. And most of us realize that. My mother's relationship with me was very complicated. My relationship with my grandmother was more of a mother-daughter relationship. And even the relationship between Carmen and I have at sometimes been complex. But the good part about it is that we are very, very intent on talking things out, talking things through, and being extremely honest. Carmen taught me how to be very honest. It's so important that you are honest in your interactions, in your experiences that you've had. Be very, very honest. I penned my autobiography as a result of the trauma, the emotional trauma that my mother and I had. It was very, very important that I wrote down all of my experiences. I remember when Maya Angelou penned the book, I Know Why the Caged Bird Sings. Maya Angelou, as you all can remember, went mute for several years because she was raped by one of her mother's suitors, one of her mother's boyfriends. And if you all can remember that story, when she told the story of her being raped, her mother made sure that this man was taken care of and his life was snuffed out. As a result of Maya Angelou, I think I'm having some feedback. As a result of Maya Angelou being raped, she observed so much that was going on around her. She ingested so much that was going on around her that she decided to write. And because of her writing, it not only saved her life, it saved the lives of other women. When I was a child, I did a lot of reading. There was a librarian, Miss Goodwin, at the East Winston Branch Library. I do believe that women are so intuitive. We know what's going on with each other a lot of times without having talked about it. And when I would step into the library, I do believe that Miss Goodwin recognized that I was going through something at home. And back in those days, we didn't talk about those things. And when I would step into the library, Miss Goodwin would always have a stack of books, different type books for me to read, whether it be National Geographic, whether it would be Greek mythology. She just always had stacks of books because she knew that my mind was highly inquisitive. And I do believe that she wanted, as well as I wanted, to be taken away from my situation. So I did a lot of reading growing up. And the reading saved my life in that I could actually leave my situation, at least through the words that I was reading. So to speed it up, when I decided to write my own autobiography, I knew that if I wrote what was going on in my life, what had happened in my life over the years, somebody who would actually read my words would actually be saved. Because books saved my life, my book could actually save somebody else's life and free them from the trauma that they had been going through. And when I decided to write my book, and it's so important, ladies, that you journal, that you write, that you ingest somebody else's stories, because somebody told me one time, we all have a story to tell. But when I decided to write my book, I sat down, not at a computer, but I actually pulled out journals and started writing longhand. And my book is approximately 350 pages. So it's not some little short story. I started at when I started remembering stuff from childhood at age 4, when I was first traumatized at age 4. And each year after that, going into the first grade, second grade, third grade, all the way up until the time I got married. And the details that I had in there, Maya Angelou had spoken about all of the details that she remembered. And I remembered so many details from my childhood, so that when the book circulated around my city, so many of the ladies would reach out to me and ask, how in the world did you remember that? How do you remember and recall all of those details? I remember this. You were so small, but to be traumatized, a lot of those memories you hold on to. Some people suppress those memories. Some people will forget those memories completely until something triggers them and it brings it back to them. But it was just very, very important that I wrote those words out for my progeny, for my own children, and for my grandchildren, so that they could see what I had gone through and what I had overcome. I overcame those issues. Throughout these few years, when I finished the book in 2016, my mother, my sister, she's my half sister, we had the verbal battles, we had the ugly words that were shared. My mother just recently passed away. And many people didn't realize we had conversations over the past couple of years. I finally reached out to my mother, and we didn't talk about the past, but we talked. And what was not said was understood. It was more of an apology on my mother's side, more than anything. One of the things that I did hear before I got off was Dr. Taylor speaking of boundaries. Boundaries are so very, very important. Part of those boundaries is stopping people from forcing you into premature forgiveness. And I know this is a very controversial topic, the forgiveness aspect. Even Jesus said, if you confess your sins, I am faithful and just to forgive you of your sins. Part of that forgiveness is when persons who have committed egregious acts against you, if they have not asked you for forgiveness, you are not forced to forgive them. It is between their God and them. A lot of times we are forced as Christians to forgive, and that goes all the way back to slavery. When I think of those 9 precious souls who were mowed down at Mother Emanuel's church, the first thing the crowd, society, onlookers, the first thing they brought out was the forgiveness aspect when they have not even had a chance to heal. A lot of times we are forced to forgive before we've even healed. Is that true forgiveness? Premature forgiveness when we are still hurting. Like I spoke of, my mother passed away just recently. In fact, last month we had her funeral. And there was a forgiveness aspect that was there that people didn't realize, but because I reached out and we talked. My sister, who was the main person who kept a lot of the agony going, she and I are talking now. And I still have my boundaries when it comes to her. It's extremely important that we read, that we write, and that we share with one another those things that we have gone through and be very, very honest. My daughter spoke of earlier getting therapy. Therapy is your friend. And my daughter sometimes she will look at me sideways and say, but Mom, you've not done it yourself. All of the information that you've dispensed to so many sisters, you're not taking that same route yourself. But therapy is your friend. And one form of therapy is talking with someone who will not only listen, but who will dispense good wisdom to you. Sharing is your friend. Sharing your stories is your friend. Now, the last thing I do want to share with you, because sometimes I can be long-winded, as people know, So I decided to make sure that I don't hijack Dr. Bennett Marsh's Zoom session today. Is a scripture that I absolutely love, and it has become my mantra. It's Isaiah 61:1. It says, the Spirit of the Lord has anointed me to preach good tidings unto the meek. He hath sent me to bind up the brokenhearted, to proclaim liberty to the captives. And when I say captives, when I see captives, those are persons who the stigma of rape, incest, sexual assault, molestation has bound their voices so much that they take this trauma to the grave with them. And I give people permission to speak. I wasn't given permission to speak. I gave myself permission to speak. But sometimes we have to give each other permission to talk about this thing, because sisters need one another's shoulders. And the opening of the prisons to those that are bound. Please remember that scripture, Isaiah 61:1. We have permission to share our stories and to free those who have been bound. And if you have any questions, just hit me up.
Thank you so much, Beverly. You rock. See, you're getting applause from everyone. Okay, so Beverly has been very transparent, but there's one secret she hasn't shared with us yet. And that secret is that she's a financial and wealth management specialist. She's an MBA and she's with Wells Fargo. Did I get it? Okay. She's a Wells Fargo wealth management specialist. So if you need any help, Beverly is prepared to give these strategies to you. While I truly believe health is wealth, there's nothing like an informed woman so that we can manage our resources effectively, leave something for the future generation, and just make sure that we stay healthy and well. Beverly, thank you very much. And last but not least, perhaps you'll come back another time and do the wealth management aspect for women. Would you like to do that? Thank you.
We can make that work, Dr. Marsh.
That sounds great, Bev. Thank you. And now we have Rosemary Wilson. Rosemary Wilson, last but not least, she is a local and international speaker. She's a human rights defender, and more than anything, she's a child of God. Rosemary wrote the book, My Journey from Sexual Abuse to Self-Empowerment. We're going to hear how she did that. She has a website that describes the book that she wrote. You can get the book from gaspingforbreath.org. In addition, Rosemary has she has a YouTube video, and I can send you everyone the link later. It's called Breaking Chains. And how does she intend to do this? She intends to break chains by empowering children. You'll hear why in a moment. Rosemary has a reputation of surpassing expectations and leaving things better than how she found them. This is how she does it. Not only does she have 30 years of leadership, mostly in local government, Rosemary Wilson, she began her career at Bridgeway House, where she developed the Transitional Employment Program. She expanded her community awareness from her parents and as a member of her local Adventist Youth Department, otherwise known as AYS. She served as Morris County's Urban League Employment Director before being promoted to the League's Economic Development Director, where she planned and coordinated the first entrepreneurial day at the then Allied Signal Corporation, Honeywell. The event was supported by several corporations, agencies, and companies, including the eight Fortune 500 companies, Allied Signal Honeywell, Novartis, the Prudential Insurance Company, Warner Lambert, Pfizer, AT&T, Jersey Central Power and Light, ExxonMobil, and Colgate Palmolive. Mrs. Wilson Murray she served as the Director of Welfare Services for many years. And later on, she served as the Human Services Director in one of the wealthiest countries in America. Rosemary Wilson supervised the departments as Human Services Director, the Division of Aging, Recreation, the Health Department, Property Maintenance, Rent Leveling, and the Emergency Annex, which is activated when a community emergency occurs. Rosemary and I are both from London, and we grew up we went to we're both from England. She's from Birmingham, but I think London is like, So Rosemary hails from Birmingham, England, and she went to a historically Black college and university where she also met Beverly Robinson and I and many others, and Odell. And she will now present to you how she empowers children, uses strategic management processes to move on from vicarious trauma, and how she helps people to sort the baggage out, pack it up so that they can move forward and go through the doors of the palace. Please, hear ye her.
Thank you so much for this incredible opportunity. I've heard you say a number of times, you've called out different individuals who are friends of yours. And it got me to remember Shakespeare once said, "It's wonderful to be in the company of friends, even if they're someone else's." So I am thrilled to be in the company of all your friends, Dr. Marsh. I do remember Beverly, and I do remember her husband from Oakwood, then college, now university. I do regret that I never got to know you as well as I could have, Beverly, but that was because of my addiction. And so Maxine has asked, Dr. Marsh has asked me to speak about forgiveness. This topic can be empowering for many. It can also be triggering for others. And so, because the World Health Organization says that there's no health without mental health, I'd like to begin with a break. Since we haven't had a commercial and we've been talking for about an hour, I'd like to start with a calming technique that I particularly enjoy, and that is pace breathing. So I'm going to take a deep breath. I'm going to hold for 3, 1, 2, 3, with my eyes closed, and then I'm going to exhale. I'm going to do that 2 more times, and I'm going to ask those of you who wish to join me to feel free to do so. So
Can
it's just
everybody mute though? We're still hearing a lot of background noise.
Maxine, you can probably mute folks.
Actually, yes, it looks like
Okay.
muted, but it looks like they're muted. Thank you. Thank you.
Okay, all right. So that was my first demonstration, and I'm going to do 2 more times. So I'm going to invite you to go along with me. And we're going to take a deep breath, hold for 3 with our eyes closed, and then exhale. Last time, take a deep breath, eyes closed, hold for 3, 1, 2, 3, exhale. And having done that, you should feel some kind of way, like a little bit more relaxed.
Yay.
I actually prefer doing safe place visualization. And if we have time at the end of my presentation, or if Maxine gives me the okay, I'll walk us through safe place visualization. So CDC statistic tells us that 1 in 5 women are sexually abused, traumatized, raped. The statistics also tells us that 1 in 17 males, I'm sorry, the first statistics was the female, 1 in 17 males abused, sexually molested, raped. So we have 1 in 5 female, 1 in 17 males. I think that the CDC statistics is not correct because I never reported, and I was sexually abused starting at age 4. I'm horrified to think of what the true statistics could look like now that we've gone through COVID, where children have been at home with molesters, abusers, and re-traumatized or traumatized. So let me throw out Ruth 4:13 and Ruth 4:17, and kind of hanging there as I use this as my backdrop. So Ruth 4:13 states, Boaz took Ruth, and she was his wife, and when he went in unto her, the Lord gave her a conception, and she bare a son. And verse 17 tells us, and the women, her neighbors, Ruth's neighbors, gave him the name Obed. He is the father of Jesse, the father of David. So what does this have to do with trauma? Hang with me. Ruth is the most famous Moabite that we know of. So who were the Moabites? Well, the Moabites came about because of incest. Remember the story of Lot's 2 daughters getting him drunk and having sex with him, and both daughters became pregnant? Well, the oldest daughter gave birth to the descendants of Moabites. And the Moabites were known biblically for incestuous behaviors, abusing people, raping people. That is what the Moabites did. The Moabites were pagan nations. They didn't worship God. They didn't believe in Yahweh, but they were wealthy, powerful, and proud. And from this group of people, we have Ruth. That tells me that the God that we serve forgives in spite of the behaviors of people. And so my focus, my life journey focus has been more of what did I learn and not what went wrong. Because what went wrong was too painful. Forgiveness is a choice. It's not an easy choice. Sure, I wanted to see my abuser hanging from the closest tree. However, not to forgive left me with unspeakable triggers, rages of emotions that I could not control. I could sit in a congregation, Christmas time, hear the pastor talk about the virgin birth, listen to the excitement and the energy around Christmas, and be triggered by that. Was I a virgin? Would God have considered me worthy of being the carrier of the King of Kings and Lords of Lords? The news is filled with stories of individuals being raped and abused, male or female. These were all triggering events for me. And I began hiding in work. I couldn't work enough. And that's the reason why I didn't develop appropriate relationship with males and females. I presented well, always did, had closets full of the appropriate clothing, but my clothing were my shield. I was a die-hard workaholic. And so I made the decision that I could no longer live this way, hiding in the shadows of my abuse, walking around with a tape recorder of his voice in my head, telling me about the secret that I needed to keep, and slowly dying. I passed out 3 times, twice at work, once at Oakwood University, from sheer exhaustion. I didn't know when I was tired. When I was working, I never took sick days. I barely took vacation days. And so I was rewarded, it would seem, every 2 years with a promotion, making a significant amount of money, living in a very nice home, but alone. And so the decision was made that I must forgive. And Maxine has shared with you that I'm the author of the book, and the book is also on Amazon. Gasping for Breath, My Journey from Childhood Sexual Abuse to Self-Empowerment. And I'm going to read from page 27 of the book. My journey to tackling my fears and making peace with a sexual assault stimulated the courage to dig deeper into the realm of forgiveness. My desire to forgive my attacker was intentional, but the forgiveness process did not happen overnight. Over time, my attitude regarding the offense and the offender changed. I let go of revenge as I plodded towards forgiveness with vigor and deep breath. And so we started off with calming technique that I did that helped. I had a wonderful friend, and I have shared in the chat my site, gaspingforbreath.org. I've also shared in the chat my YouTube channel where I've talked about the process that I went through to get to the place of stability, to get to the place of wholeness. And I also wrote a second book, Rosa Ann Scott, Stories for Boys and Girls, The Adventures of Robert and Ruth, to help parents, to help empower children with coping skills so that they can become confident in themselves. And there is a story in this book that talks about grooming to help parents, giving them the platform that they need to open or begin the conversation on grooming. So the question can be, why forgive? And how did that make me feel? Well, like I stated, if I didn't forgive, I felt that if I did not forgive, I was signing my death sentence. I was now passing out because I couldn't tell when I was tired. I was working all the time. I was, at this point, a welfare director. And being a welfare director, I could easily work 24 hours a day. You know, the emergencies do not happen between 9 and 5, as you already know. And so I could get a call from the police at 2 o'clock in the morning because of an event that was taking place in a person's life. I could get a call on a Sabbath morning, afternoon, whether I'm in church or not. And so working as a welfare director was consuming in terms of my time, but that wasn't enough for me. I became a AY leader, did that for 2 terms, eventually did pretty much all the offices in the Seventh-day Adventist Church, and eventually became an ordained elder. I eventually served on the executive committee for what we called Allegheny East Conference. I was working myself to death and still felt that I wasn't working enough. And so why was I working so much? Because I needed to silence the voice in my head that was telling me that this was a secret and that I couldn't share this information with anyone. I could only get relief when I worked. Work to me was no different than what a person does who's an alcoholic. No different than what a person does who's shooting up heroin. It's just a way that you manage. And so I developed a negative way of managing my fears that was suffocating me. And so because of this, it was important for me to forgive. And I think as Beverly Robinson stated earlier, you can't tell a person when to forgive. You can't tell them that after an event that now you must forgive. Forgiveness is a process. It took me probably 22 years to get to the place where I felt comfortable enough to share my story with anyone who wanted to know. But I had a rock, a wind beneath my wings, and her name is Rose. And she appears, I think, maybe 3 or 4 times on my YouTube channel. Rose and I became friends at 11 years old. And I'm not sure where between us both we got the information how to walk this dark road of trauma. But I would not be alive today if it was not for her and her willingness to walk alongside me. She would call me from London, she would call Oakwood to make sure that my day was okay. When I started working and I was dealing with different issues, Rose would be the one that would walk alongside me and call me and mirror through what I was experiencing at work. I presented well. I could deal with any type of emergency on the job, but when that was over and I returned home, I was a basket case. And so having lived in the shadow, I made the decision that I was already dead. And so I needed to live, and maybe I needed to try forgiveness because I've done everything else. And forgiveness worked for me. I got down on my knees. I remember the day, the night. I held onto the carpet with my nails and I wept and wept and wept. And the angels, I could imagine, lifted me up, put me in my bed, and I slept. And the miracle to that event was when I woke up the next morning, the voice was gone. Wow. And has never, ever returned. There are times that I've tried to remember his voice, but it's completely gone. And so I give God thanks. I give him the glory for taking me through, as Psalms 23 states, that we go through the valley of the shadows of death. And so that forgiveness helped me later on when I experienced another trauma, and that was a stalker a stalker who had a plan and was about to execute that plan in killing me. But because I'd already forgiven the sexual abuser, it became easier, not easy, but it became easier for me to forgive the stalker. Okay, Maxine, I hope that I stayed within the time frame that you've given me.
Rosemary, you did great. Everyone did fantastic. Peggy, thank you so much. Everybody, give everybody a hand. Okay, so ladies and gentlemen, outstanding Rosemary, outstanding Carmen, Beverly, Dr. Watkins, Dr. Dixon, I'm so happy I'm mixed up. Dolores Taylor, thank you, Dolores, for taking us through the importance of spiritual renewal. Thank you, Angela, for taking us through the eyes being the windows of the soul and of the body. Thank you so much, Dr. Carmen, for showing us that vicarious trauma can occur in school. Thank you, Beverly, for showing us that we have to be transparent. Thank you for the mental clarity in working through grief that we get. Again, Dr. Dolores Taylor. Dr. Watson, Angela Dixon Watson, thank you so much for showing us how you get spiritual strength from not looking down on the help that God has for you. Mr. Walter Murray, CPA, Dr. Walter Murray, thank you for being behind Rosemary, because a woman is only as good as the man that is supporting her. Rosemary, thank you for your strength and your transparency. Dr. Carmen, again, everybody, Dr. Callender, Linda Powell, thank you for inviting me. And Peggy, would you like to say something about, a quick something to wrap up about trauma when you were going through school, how you felt? Peggy, Morris, Linda, Wyoming, and Sharon are the original 4 Sisters for Sisters. Well, there's one more, I think. But go ahead, Peggy. Take it away. Charlene,
I just want to say that I didn't know what to expect. I mean, I know you were a powerhouse, and I knew that you knew a lot of powerful sisters, but I think today was a true example of what you have delivered. So we have to thank you, my sister. 4 Sisters Live has a platform that we're always looking for resources and individuals to have the expertise to share, to empower and to educate our community. And I sent Linda a text message and said, Linda, I think we have the platform that we can reach out and have these ladies come on to share their expertise. Yes. So just be on the lookout. We're coming after you. We know who you are. We know how to get in contact with you. So all I can say was well done. I learned so much, always engaging, and we must do this again.
Yes.
Health is wealth. Thank you all. And if you have any books that you want to promote or any services like Dr. Carmen did, Beverly, Rosemary, Angela Dixon Watson, Angela Pitts, any Sisters for Sisters is the platform. They will promote your books, and look out for my book too. Hypertension.
Hey, Maxine, can I make a correction? I just want to make sure, because there is another organization.
You're right.
We're actually Sisters for the number 4 Sisters Network. Network is the key. There is another organization that is Sisters for Sisters Incorporated. And so we don't want to confuse them. And that can happen so easily. So I just wanted to make sure we make it clear. Okay, thank you.
Thanks, Peggy. Thank you, everyone. We must do this again. Blessings and have a fantastic weekend.
Thank you, Dr. Marsh. Thank you, sisters.
Thank you.
You're welcome. Thank you. Bye-bye.
Bye-bye.
Thank you
Nice
so
to meet you.
much. Thank you so much.
Bye-bye.
Bye.
Bye-bye.